Good morning, everyone. I am Doug Moore, the Chief Communications Officer for St. Louis County. Dr. Page wanted me to ask Spring Schmidt, our co-acting director of the Health Department, to make some remarks today about the vaccine distribution. So, Spring, could you come on up?
Good morning. Today I'd like to provide a summary of our vaccination efforts so far in St. Louis County. Last week, we expanded our vaccination operation, opening 4 additional sites for a total of 5. We now offer vaccinations at John C. Murphy Health Center in Berkeley, the Florissant Valley campus of St. Louis Community College in Ferguson, and the fire districts in Afton, Eureka, and Melville. As a result, last week alone, we were able to vaccinate about 5,100 people. That's significantly higher than the 2,500 we vaccinated during the previous week. Our total number of vaccinations since we first received vaccine from the state is about 10,000 first doses and 700 second doses. Moving forward, we are committed to vaccinating at least 5,000 people every week, so long as we get enough vaccine to do the job. And we're already working on plans to expand our efforts even further. I need to emphasize that none of our locations offers walk-up service. Everyone we vaccinate must be pre-registered. Again, no one who comes to one of our locations without an appointment will get vaccinated. The state decides which categories of people can get the vaccine, and we're working to reach the most vulnerable residents in those categories as quickly as we can. Please understand that the demand for vaccine far outweighs the supply. In fact, as of Friday, more than 281,000 people had pre-registered to be vaccinated by St. Louis County. The quickest way to pre-register with us is to visit stlcorona.com and click on the vaccine registration link. If you prefer, you can email us at dphcovidvaccine@stlouisco.com. Finally, those who do not have access to the internet may call our hotline from 8 a.m. to 5 p.m. Monday through Friday at 314-615-2660. Please know that the hotline is being flooded with calls. So remember, it's only for people who do not have access to the internet. If you call for other reasons, you might be further delaying registration for someone else. Please note that calling us for an appointment is not a faster access point than pre-registration. The call is to help people get pre-registered. It does not result in faster appointments. We encourage residents not only to register with us, but also register with a local hospital to get vaccinated. If you get an appointment opportunity there first, please take it. But once you make your appointment there, please don't make any other appointments. We will reach out to those who have registered with us to schedule your appointment. You are only eligible for an appointment if you have pre-registered and meet the criteria for the current tiers opened by the state of Missouri. Those who register by telephone with us will also receive a telephone call. Please understand that we are on a very tight schedule, and you need to make an appointment as soon as we tell you that one is available for you. We must operate this way to make sure the vaccine gets used immediately and to get as many people vaccinated as quickly as we can. I want to remind everyone not to try to make an appointment unless we have contacted you directly. Trying to game the system in that way is both selfish and inappropriate. As I said earlier, we are working hard to make sure our most vulnerable residents get vaccinated first. Anyone who cuts in line is potentially depriving someone else of their fair chance to receive the vaccine. I want to thank this entire community for your patience as we work to improve access to vaccination for everyone who wants one. We all want to return to normal, and getting vaccinated is one of the best ways to get there. In the meantime, please continue to wear your masks, avoid crowds, keep your distance, and wash your hands. And now I'm happy to answer questions.
Spring, we have a few beginning with Channel 4. St. Louis County's percentage of vaccine received based on population is far below many other counties in the state. It's been this way for more than a week. What is St. Louis County doing to fight for a fair share for the state's most populated county?
All of St. Louis County is mobilized to advocate for the access to our residents for St. Louis County by the per capita in our population, as well as for all of Region C, quite frankly. It's very important that we get a proportional amount of vaccine in order to be able to keep this pace up and improve the vaccine rates among our residents.
Last week on a call with Dr. Randall Williams with the State Senator Jill Shoup mentioned that St. Louis County would be sending an email out to everyone that's registered for a vaccine. When should people expect these emails, and what information will be in that email?
So they started about a week ago. We started going out in small batches of a couple thousand at a time. We don't want those 281,000 emails to get caught up in people's spam filters. We just want to make sure we're communicating with you. So those are coming out every day. It's for a few thousand more, and it does contain information to make sure that you do know that you are pre-registered with us, and that we will continue to reach out to you and any other updates that we can keep moving as we go forward.
And what should someone do if they don't receive an email from the county health department in the next week or so?
So yeah, I would wait about a week to make sure that we have gotten through those first several thousand emails. But if you have pre-registered with us and you do not receive an email, please feel free to pre-register again. We want to make sure that you are on the system and that we are able to communicate with you.
Some people have contacted the media with complaints that people are coming from out of state and are able to get the vaccine. Is the county doing anything to prioritize St. Louis County residents at these county mass vaccination sites you've opened?
The state of Missouri has said that their focus is Missouri residents for the vaccine that they have been delivered. However, they have also asked us to make sure that we are not filtering out by jurisdiction. So while we do advertise to St. Louis County residents and make sure that we are communicating with them, we are not filtering out other residents of Missouri who may come to one of our sites.
Another question, is the county going to oversee the vaccination rollout for the city of St. Louis? And if so, how will that work?
So St. Louis County actually has no role in the vaccine distribution for the city of St. Louis, except as colleagues and friends who are all trying to work through this together.
Why is the current positivity rate described as worrisome? And how does St. Louis County compare to surrounding areas? Will anything like this summer's survey happen again so that we can gauge how much virus is in our community?
So we always watch the positivity rate. It's not the only metric that we pay attention to. We do have some lowering cases lately, which is great, but the positivity rate is still remaining about 8 or 9% on most days. So it's not dropping as much as we would like it to be, which means that there is still some free-flowing transmission that's happening in our community. We have considered whether we would do another prevalence study, but we don't currently have any announcements at this time for it.
With the confirmation of the UK variant in Missouri, what metrics will you be watching to determine if we need to return to any restrictions, and what are those thresholds?
So we would continue to watch case transmission rates, the reproductivity rate in particular. It is possible, but there has not been a settled science at this moment on what the UK variant's actual transmission increases should mark to look for as far as a threshold is concerned. So we will have to watch our own numbers very carefully as we keep watching the science as it develops on a national and international scale, but we will continue to watch case transmissions in particular.
Finally, I know the county has not received doses in the last 2 weeks. Are you expecting to get some vaccine doses this week?
I certainly hope so. I do not currently have any confirmation of delivery directly from the state. St. Louis County is a high throughput healthcare consortium, but I do not have confirmation of vaccine doses to share with you today.
That's all we have. Thank you, Spring.
Thank you.